When it comes down to it, the cancer carers, they aren't the patient's family. They're just a person that's so genuine in the way that they care for patients and families.
And a number of them also are people who have been through the journey. They know what to expect. They know when there'll be ups and when they're downs. And when they sit with and work with people who are going through that journey now, that is incredibly valued by those people.
Our charity is all voluntary. We support all cancer patients, from little kids to grown-ups. Been fairly lucky in life, and we just give it back. And I think that's what most of the other carers do.
My sister had cancer and I nursed her while I could, and I used to help her and give her massages without actually realising that this is what you should do. And then I thought, if I can do it for her, I can do it for other people.
I started working on the ward the way a lot of the carers started working. My father-in-law was in hospital and he was well looked after by the staff, but he was also well looked after by the carers. And I thought, what a great group of people.
I think everybody knows how much they're appreciated, but you feel good when you're here because they appreciate everything that you do for them. They just think it's just wonderful, and you go away yourself feeling as though you've done something really good for people.
I've been a cancer carer for about 15 years. Most of them just like to see another face apart from nurses or doctors or whatever. And well, up in the ward we basically offer patients feet or a hand massage. Some we have to really talk them into it, and once we've talked them into it, they love it too.
And it gives one a lot of satisfaction because you see and appreciate how much people get out of the help that we give them. And they're so grateful, and you really feel that you're making a difference to their suffering. So they have a lot of appreciation for that.
The carers would like to see the people of Wollongong have as good or better treatment than anywhere else in Australia.
So there's things like transport assistance for patients, which is invaluable for patients that can't get in for treatment.
If you can't get here, you can't have your treatment. There are issues with public transport and so forth. So the amount of patients brought in on a day-to-day basis by that service is phenomenal.
Going around to all the patients and saying hello to them and just generally providing a supportive environment to them.
And just to be able to have a chat or make a cup of tea.
They also provide like massage therapy for patients, hand and foot massages, which is very nice.
And you might say that's quite trivial, but the patients pretty much appreciate that and take that as something that they enjoy from a day-to-day basis.
Yeah. Just, a bit of a chat and just to draw their attention, away from the issue at hand. It's just, yeah.
They may not actually access any of their services, but the fact that that organisation exists, I think, sends a pretty powerful message to people that they are supported in their journey, and if there are things that they need, they'll be able to access them.
Of course, then there's all of their fundraising efforts assist us in purchasing much needed equipment for the hospital.
They raise money by collecting corks, by making toys, by making quilts, by having market day stalls.
Ultimately, those efforts accumulate into a pretty significant contribution to the department. It's not like it's money that's just easily come by. It takes a hell of a lot of time and effort to generate that amount of money, and we're not talking small amounts of money.
Everything we do is for the patient, and everything that they work hard to raise money for is for our cancer patients and our community.
When I look around, all the extra things that make life comfortable come from you. The beds in the hospital, the artwork in the cancer centre, all the little extra pieces that we can't afford to buy, you buy to make it more comfortable for our patients. So thank you.
And they're just an excellent resource to the staff because we're such a busy unit that we just don't have the time that we'd like to make, do the little extra things that the carers do for us.
It's someone here who can sort of take control for a minute, maybe bring them a box of tissues, whatever it is at the moment that's required, just someone there to do that. And whilst we try and do that as staff, often we're not there at that moment and not able necessarily to do those things.
I've worked in plenty of places where there isn't an equivalent organisation. It's at the detriment of the service that those facilities can provide.
But most importantly, they're just another support person, and that's fantastic because that's what they need. An impartial person that's not a hospital representative, that's not a family member, that somebody can talk freely to.
We as health professionals, teamed with them as the organisation supporting our patients and what we do, makes a great team, and we should continue to work on that relationship to make sure that what we do here is the best it can be. And without them, we couldn't be what we are today.